Thanks. Hello everyone. My name is Tara and I am a practicing dietitian. My background is diabetes, obesity, bariatric surgery. And today I'm going to talk very, very briefly, I only have 10 minutes, about food and metabolic health. But I guess the first thing that I think everybody in this room can agree on, here we are, is the confusion around diet at the moment. So every single day I have patients coming to clinic, and I'm sure all of you do as well, and I'm sure you are confused yourselves about diet at the moment. So why are we confused, and why are our patients coming to us confused? This is 32 different headlines. Chocolate beats diabetes, pills beat diabetes, vaccines beat diabetes. It's so difficult, and I never ever judge a patient for coming to clinic and just saying, look, I'm completely fed up, I don't know what to do, I keep hearing different things. And what I think is most important for us as healthcare professionals is that we need to be pushing the same message. It's really, really difficult when you get a patient coming to clinic and they say, well, this person told me this, my doctor told me this. And I think that what we really need to do as a whole is just to get back to basics. I really do think that. I'm not going to bore you all with this. We all know about macronutrients. We know about protein, we know that they're essential in the diet. Our body can't make amino acids or some of the amino acids ourselves. We know about fats. Fats are completely essential to our body. We have this idea that fats are a bad thing, and this low-fat message has been pushed for such a long time. Yes, these types of fats, absolutely. Trans fats, fats in refined foods absolutely have no place for our diet, but I would absolutely argue with anybody who says that we don't have place in our lives for healthy fats. And when we think about metabolic syndrome, the one thing we obviously need to think about is carbohydrates. Can I ask anybody in this room if they know what the minimum amount of carbohydrates that our body needs every day is? Does anybody have any ideas? Zero. Yes, that was a trick question. So we do not have any direct physiological requirement for carbohydrates in our diet. Our body can make all the glucose that it needs itself. That is not to say that carbohydrates can't be used as an energy source for some people, but we really, really need to think about metabolic health, insulin resistance, type 2 diabetes, pre-diabetes, and how quality and quantity of carbohydrates are so important. When we think about sugars, we think about simple sugars that are broken down. Everybody in this room knows, and I think the public even know where sugars come from. So they come from our sweet foods, they come from takeaways and the things that we should be avoiding. But what about starch? So we have this some guidance that the general population, the healthy adult, should be having their meals based on starch. But do we know what starch actually is? And do we know what the building blocks of starch actually are? Does anybody know? Don't answer. Anyone else? Yes, absolutely. We know that starch comes through digestion and are broken down to glucose. And I think we really need to remember that. So when we think about calories and our macronutrients, are they all equal? I would argue no. If we have patients who are insulin resistant and a population who are pre-diabetic and type 2 diabetic, if we are recommending diets extremely high in sugars, whether that's from obvious sugars, free sugars, or it's from carbohydrate, we are going to see a blood glucose response. Protein, we can see for some people has a glucose response, and my best friend fat down there, the healthy fats, generally, we don't see much of a response, and we need to remember that for our metabolically unhealthy patients. I'm not going to run through all of this, but we need to think about free sugars in our diet, and then ultra-processed foods. So this is a very long slide, so I won't go through all of this, but I do want to highlight some things about free sugars. I often have patients come to me and say, I've cut out all the sugar, I'm baking cakes, I'm using honey instead, things like that. So sugars which are naturally present in foods also count towards free sugars. I'm not sure if anyone's familiar with Dr. Zoe Harcum, but she always says that when people ask about what is real food, so I say fish swim in the sea, but fish fingers don't. Butter comes from cows, margarines that are hydrogenated don't. So it really is very simple. This is NDNS data from 2015-2016. And just very briefly to point out, the free sugars intake is recommended to be within less than 5%. And here we can see that it's double for all adults and children. if not more. But what I really think is really interesting, and maybe I'll ask another question, in 1.5-year-olds to 10-year-olds, where do we think that the most free sugars from our children's diets are coming from? Does anyone have any ideas? Sorry? Say again? Drinks, close, very close, but not the number one. Cereals and cereal products, absolutely. Followed by juices. So this is really something we need to remember. Telling our children to eat the healthy breakfast cereals, this is contributing towards most of the ultra-processed free sugars in our children's diet. For adults, so 19 to 64-year-olds, any ideas? Same question? Yes, so confectionery is the number one component of free sugars in our diet at 25%. Cereal and cereal products follow very, very closely at 24%. So essentially, we're getting the same amount of free sugars in our diet from cereal and cereal products than we are from confectionery. So I think we really need to remember that. Just more information, another study published in the BMJ just earlier this month, so showing starchy foods, breakfast cereals, drinks, sugary products to be a massive component of ultra-processed foods in our diet. So when we think about carbohydrates, we have to think about the glycemic index. I'm not the biggest fan of the GI index myself, but I do think it is important to note that every patient is different and everybody's going to have a different response from carbohydrates. So it's a ranking on how a carbohydrate will affect the blood glucose level of an individual. So lower GI, meaning that it digests slower and doesn't have as much of a blood glucose response, but of course the GI does not take into account the portion sizes of food. So often you'll see documentation saying, oh well, pasta is a low GI food. I challenge anyone in this room or any person in this country to have a huge bowl of pasta and then check their blood glucose levels. And if you are insulin resistant, type 2 or pre-diabetic, you're going to have a huge response to that. So here are some healthy foods, or so-called healthy foods: dates, watermelons, rice, bran flakes, all extremely high in GI. The glycemic load is something we need to take into account. So we can choose from the lower GI foods, but we also need to take into account the amount of carbohydrate within that food. So just as one very brief example, often patients will come to clinic and say, Tara, I'm doing great. I've switched over to all the brown things. I'm eating whole grains. I'm having brown pasta. So we'll say, okay, let's look on the scale. Yes, it's a low to medium GI food, but it's a very high glycemic load. And if any of our patients have glucometers, I would always ask them to check when they eat these types of foods to see their response. And generally, by the next time they come back to me, the pasta is gone. This is just one very brief example, I know I haven't got much time, of an extremely, extremely distressed 32-year-old lady who came to me in clinic. Metabolic syndrome, type 2 diabetic, and this was an example of her blood glucose levels. So her Diasend download, 17, 20 plus average a day. I only had about 5 minutes with her in clinic, and she just said, please, just tell me what to do. I'll do anything at this stage, just tell me what to do. I simply said, just eat real food. Please just go and eat real food, and then just come back to me in 4 weeks, and we'll have a proper discussion about how we go on further. So that's all I said, eat real food. She comes back 4 weeks later, and this was over Christmas, can I say? Her blood glucose levels averaging 6, 7. I said, what have you done? And she said, I just stopped eating foods from packets. That's all I've done. And since then, this was in January, since then she hasn't really done very much else apart from eats real food, looks at her carbohydrate portions, still has the occasional treat, but has got so much energy, she's now signed up to do a half marathon. So this is a lady who came in completely distressed, my life is over, and 3 really, really simple words brought her from that to that. I have to finish up now, but my overall message for us is to, especially healthcare professionals, I think it's really important that we educate ourselves first, and then we educate our patients. So we have to give them that choice. We cannot have them coming into clinic and just giving them more drugs without giving them a choice to look at their diet. If any of you are GPs, you'll see that there's many GPs across the country who are saving so much money in deprescribing diabetic drugs. Avoiding highly processed foods. It's really basic stuff, this is. What I like to do is focus heavily on the foods that my patients should enjoy and can enjoy. Reconsidering low-fat products, so making sure if we're having low-fat products to watch that they haven't been lots of extra sugars added. If a patient wants to have carbohydrates, making sure they have the low carbohydrates. And I think support and encouragement from healthcare professionals is so, so important, and especially GPs and doctors in the room. Patients really, really, in my opinion, love to get some good feedback from you. And this lady with these blood glucose levels came in, and the first thing she said is, "Where's the consultant? I want to show them something." So I thought, okay, well, never mind what I said, we'll go tell the consultant. But they really, really do like to see their healthcare professionals taking some interest in their own health. And I think, last thing, just some resources for everyone. Everybody here has, we're all stretched. 10-minute appointments is not enough time to go through somebody's diet, but you can certainly, there's lots of resources out there for patients. I can see on these tables here, you've got some lovely resources for exercise, and anybody who doesn't work in this area, I always use students or work experience people. Really, really good to get them in, get them to look around the local areas, cookery classes, anything else that you can think that will help people with their diets. And I think that's it.
Brilliant, thank you, Tara.